Hello. Hello.
Hanji sir, good afternoon.
Is it audible?
Hanji sir, you are audible. We'll just start in 5 minutes.
Okay. I am just trying to share. Just check whether it is visible or not.
ठीक है sir, Hanji.
Is it visible?
Hanji, it's visible sir.
Okay. I'll make just a full screen.
64 slides.
Yeah. Is it okay?
Hanji sir, it's
Yeah.
visible.
Okay.
GADVASU. I, Dr. Simranpreet Kaur from the School of Public Health and Zoonosis, extend a very warm welcome to all of you in this national webinar on food safety, which is a very emerging topic these days. So before I introduce our eminent speaker to you all, I would request you to keep yourselves mute during the entire talk and put your questions in the chat box. So after the talk is complete, we will take up your questions one by one and we'll have a brief question answer session. So it's my pleasure to introduce the speaker of today's talk. So the speaker is a very eminent veterinary public health specialist, Dr. Kiran Bhilegonkar, who is the principal scientist and station in charge in the Training and Research Institute, ICR, the Indian Veterinary Research Institute campus in Pune. Dr. Bhilegonkar has about 32 years of research and training experience in the area of zoonotic diseases and food safety. He is the author and co-author of about 125 peer-reviewed research publications in national and international journals and several book chapters on food safety and zoonosis, and is the editor of Journal of Veterinary Public Health. Dr. Bhilegaonkar is an authority in the area of food safety. He is the member of International Commission on Microbiological Specifications for Foods. He is the fellow of Indian Association of Veterinary Public Health Specialists and associate of National Academy of Agricultural Sciences, India. Dr. Kiran has been contributing in developing national food safety standards as a member to scientific panels and expert committees and various task force groups of the Food Safety and Standards Authority of India, that is the FSSAI, and the Bureau of Indian Standards for the past several years. So with this introduction, I extend a very warm welcome to Dr. Bhilegaonkar to present his talk and invite him to present his talk on the topic, the new dimensions in food safety and public health, role of national and international organizations. Dr. Bhilegaonkar, please.
Thank you very much, Dr. Simran. First of all, a very happy Lodi and happy Makar Sankranti to all. I take this opportunity to thank the organizers of GADVASU and the project under which this webinar has been organized. A very uh, thank you for inviting me for this talk. And as Dr. Simran has told me, the talk today would be on food safety, public health, and role of national and international organizations. And I welcome you all, the participants, for this talk. I have divided my talk in major two parts. The first part is like introduction and food safety hazards, how to manage those food safety hazards, how to protect public health. And then second part would be the role of national and international organizations, which play a pivotal role in managing food safety. So food safety, you all know, is a very, very important subject globally. Everyone is kind of exposed to some kind of a food safety issue in their lifetime. And these global and Indian newspaper or the media headlines clearly indicate that every now and then it becomes a headline. You have heard about recent bird flu episode also, and there are a lot of problems associated with it. There were issues related to Maggie, issues related to the antibiotic residues in chicken samples, pesticides. So microbes, pesticides, antibiotics, all different kinds of hazards, they are very important issues related to food safety. But how many cases they are occurring throughout the world due to these food safety issues? The exact burden, although is very difficult to estimate, but World Health Organization, there was a foodborne epidemiology reference group, that is FERG. They have roughly estimated that about 600 million cases throughout the world, they occur because of foodborne illnesses every year, with almost about 5 lakh deaths which are occurring, with between 3 to 6 lakh deaths annually occurring because of these. So one in every 10 persons of a global population, they get affected with foodborne diseases. And there are huge losses because of foodborne illnesses, foodborne episodes throughout the world. What about India? India, here is the place where we stand. Out of cases which are occurring per 100,000, we are somewhere in between, middle of the rung. Neither we have a very high numbers like some of the African countries or South American countries, nor we are very good in terms of food safety management like of Europe or USA or other developed countries. We are getting about 8,500 cases per 100,000 people, that is 1 lakh people. And when we convert it into our population of 1.3 billion, so we are getting about 111, 112 million cases. So about roughly 11 to 12 crores of people, they get affected every year. And one of the report in 2017 that is almost similar, gives a similar numbers, about 10 crores. And they have estimated that we are almost losing 12 to 50 billion uh, US dollars every year because of these foodborne illnesses, because of health, because of treatment, because of life lost, and also and so forth. And in the same paper, they have estimated that these are very, very underestimated figures. And if we have some kind of a accurate estimate, they feel that we have almost 3 billion cases in India. So every person is getting affected twice in a year, somewhere, sometimes diarrhea, sometimes vomiting. So I think these estimates are quite realistic. Almost everybody experiences some kind of foodborne episodes uh, almost regularly. What are different types of hazards, food safety hazards, which are affecting the public health? So, microbial hazards, they are among the very important hazards, Salmonella, E. coli, Listerias, and so on and so forth. Similarly, drug residues, 2 years back, there were problems of antibiotic residues in chicken meat. Now also last month, there were problems related to honey. Then pesticide residues in cola was a big issue in India a few years back. There are other contaminants like metal, which was issue related to the Maggi noodles uh, 3 or 4 years back. Then there are several other biological toxins. Uh, Genetically modified foods, GM foods, are not uh, allowed in India, so we do not have this particular food safety issue right now. And allergens, Western countries, they are now focusing on allergens. We have to solve the contaminants, residues, microbial hazard problems. So as of now, our focus on allergens is comparatively less. So how these hazards get into the food and how they cause our public health problems. So coming to first, microorganisms. Uh, Microorganisms, they are found everywhere. There are niche of microorganisms in animals. Several microorganisms, they reside in animals. There are several microorganisms that are found in soil, water, environment. There are organisms like vibrios and aeromonas, which are often found in the aquatic animals, aquatic environments. And there are several microorganisms which are very commonly seen in human being, like norovirus, shigella, amoeba, giardia, and so on and so forth. So these all uh, organisms, although they have a specific host range, but they keep on moving from environment to animal to human to aquatic to, and keep on moving all around. And through foods of animal origin, through aquatic food, through foods of plant origin, or through water bodies, water consumption, they can cause public health problems and illnesses. Regarding the pesticides, antibiotics, heavy metal, how they enter the food chain. As we know, pesticides, they are very often used for the plants for protection from the pests. Then through plants, these can leach into the farmlands and water bodies. They can go when we feed these plant material as a fodder to animal. Through animal feed, it can go to animals, and then through animal, either through dairy products or through meat and meat product, it can go through animal origin food to human. Similarly, from plant, if withdrawal period or sufficient time is not allowed, through plant-based food also, we have experienced the pesticide residues coming. And through lakes to aquaculture, through aquatic food, again to human being. For antibiotics or drugs, usually they are used for animal treatment or for aquaculture for treatment of fishes or shellfishes, diseases of them. So through it is also used, there is a common practice to use it in poultry feed, animal feed, but the guidelines and regulations say that we should not use any antibiotics in feed. So these are the routes through animal origin food it can come, or through aquaculture it can come to human being. The heavy metals are generally seen in the soil. They are also coming out due to industrial waste, industrial effluent, and then they can contaminate plant food, or they can seep into the water bodies, and then similar routes through plant food, through animal origin, plant-based food, or through aquatic food, it can cause diseases or issues related to these residues and microorganisms in human being. How do we protect public health protection from these hazards? So there are practices of food safety management systems which are used in industry. As a government regulator or as an international UN body regulators, they have certain food control systems where they set standards, and then all the industry, they have to meet those regulations and standards. So this is a brief one slide about the food safety management changes which have happened over a period of time during last 50 years. Initially, it was thought that, okay, we can test an end product which is coming in the market, and then we can assure, okay, it is fine. But this end product testing is often not very useful, almost not useful for the microbiological testing. It may be of little value in case of antibiotic residues or in case of some chemical residues, but definitely not in microbiological testing. Then concept of HACCP came. Then it was a preventive control with farm to fork approach, but it was also insufficient. Then risk based approaches came. Then now people are thinking these are also not enough. Now we have to go for some systems approach. And then maybe in future we will see all kinds of digital inputs, digital technology coming into play. I'll come to all of these in details in next few slides. So first we will start with end product testing. Now these are two different lots. One is above the line. These are 5 samples. And these 5 samples, they are very good. They do not have any problems. All are passed. Below is another lot where one sample has shown some kind of a problem of microorganisms, problem of contamination. So what do you think of it? That means you will feel that, okay, the first lot, all packets, all cartons are very good, and therefore it has come out as a negative sample. All samples are negative. In the second lot, you will think that, okay, there are certain cartons, certain packets where there are microorganisms. So while picking up 5 samples, we have come across, and then one sample is negative. But it may so happen that this and this lot are similar, but while picking up the samples, that is only end product testing, you have picked up only those cartons where there are no organisms, and therefore it has come as a negative. Whereas on the other hand, it may so happen that there are all good sample except one sample or 2 samples which are not good, or 1 or 2 cartons, and therefore it has given a negative results. That is, a result which is positive, and then you will say that this lot is not good. So whether we should rely only on end product testing, we can, in some aspects, we can say that yes, it is useful. How it is useful? it indicates that when there is a positive sample, it indicates that there is some problem. Positive means there is problem in this lot, and there are some food packets which may contain organism, but negatives doesn't give guarantee that this food lot is entirely good. So only end product testing would not be sufficient. So we have to go for back from farm to fork. So entire food supply chain approach came, right from farm to processing to transportation to retail to consumer. So this farm to fork approach came into existence. And then in this HACCP concept came. The HACCP concept came for the, that is hazard analysis critical control point approach, which came, basically it came for manufacturing units, all the good manufacturing practices, good hygienic practices. It has a long history. It started, this concept came by NASA and Pillsbury Company. Then later on, it was first introduced for food safety in one of the conferences. Then International Commission on Microbiological Specification for Foods and WHO. These ICMSF is the pioneer to use this concept in food system. They presented the report, then finally in 80s, then 83, Europe adopted, US adopted, and then finally Codex recommended and formulated guidelines. Now it is world over used as one of the best food safety management systems. And these are different 7 principles. I would not go into details of them, but here the analysis of hazard is done, then controls are identified, these controls are monitored, they are verified, corrective actions are taken, and all the data has to be recorded. This all system is auditable system, and therefore being used in the industry very extensively. But again, this was a hazard based system. Only hazards were monitored. So it is not enough to protect the public. So next step came, that is risk based approach. Now, what is a risk based approach? I will come to next few slides, differentiating hazard and risk. But these hazards have to be linked to risks. Risk means health outcomes in human beings. What are health outcomes? How many illnesses? How many deaths? So these hazards have to be linked to risks. So new concept came related to risk assessment. Then new quantitative metrics also came in addition to microbiological criteria. So these concepts were introduced. So what is hazard versus risk? Here is an example. This is a speeding truck. It's very dangerous. It's a hazardous. And here is a man who is walking on footpath. So a speeding truck on the road and man on footpath, there would not be any risk unless that this person goes in front of this speeding truck, or this speeding truck comes and rams on the footpath, rams on him in the footpath. So this becomes a risk. But this is only a hazard. So similarly, on the meat, if raw meat contains several organisms, hazard is definitely present, but generally we do not eat raw meat. So raw meat consumption, except maybe in 1 or 2 countries, raw meat consumption is not there. So risk is not there if the hazard is present on the meat. We are cooking meat. So when we cook meat, risk definitely get reduced, and there is relatively less risk if we heat it at the low temperature. If we are boiling it, risk almost gets eliminated, particularly microbiological risk gets eliminated. There may be some kinds of antibiotic or pesticides, they may even remain after cooking. That is a different thing. But here is an example of ready to eat meat product. If it contains organism, definitely it is going to be a very high risk. So risk relative to how products are there, how we are going to process them, and how much quantity we are consuming. So all these parameters, they are taken into consideration for the assessment of risk. So in the risk-based approach, the concepts of risk analysis came. So risk analysis, it is divided again into three. Risk assessment, it clearly indicates that how to assess risk. What are all different parameters on which risk has to be assessed. So these are, here are different four parameters: identification, characterization, exposure assessment, and all those things. Then second part comes management. Once we have identified risk, we have to find out how we have to manage these risks. And then risk communication, it is very important thing. We have seen in corona outbreaks that the risk of corona was very well communicated throughout the world. Every person now knows about this risk, and everyone is taking the precautions which were identified in the risk management. So similarly, we have to do it for some food safety related issues. uh, it may be any issue, maybe pesticide, maybe antibiotic, maybe microbiological. Then the different metrics, they were also devised and designed, like acceptable level of population which needs to be protected. That is, how many number of cases are permissible, or how many number of cases should be reduced. So these all matrices, then food safety objective, maximum permissible level at the time of consumption. And these concepts, again, these concepts were first introduced by ICMSF, and they are now being used they have been ratified or recommended by Codex, and being used world over for food safety management. Then in the entire food chain, in addition to manufacturing, good agricultural practices at primary production level, or good animal husbandry practices, these concepts also came. Now these are also certifiable concepts, and auditing, certification of all these management system, GAPs and GAHPs, are being now done. But the entire food chain, that is farm to fork, it is not a very linear chain. There are different systems which are playing interface or interactions with this chain. Here on agricultural farm, there may be animals which are coming, they may be contaminating fields. There are human interventions which are responsible for all kinds of food safety issue. There are environmental issues like effluent which is coming with all kinds of contaminants, or water bodies, or floods which are coming and causing contamination of crops. So all kinds of different systems, they are interacting with production. Same is the case with transportation, manufacturing. So human animal environment interface is constantly available in all these places. So all systems, they are integrated, and they are playing role in the food safety. One of the very often cited example why farm to fork simple linear approach is not there is this example of US. Simple burger, when it is prepared, we need patty, burger, cheese, all kinds of vegetables, buns. So how these are prepared? For bun, these many ingredients, so many ingredients, they come into preparation of this. Likewise for cheese, for vegetables, for seasonings, for sauces, so many ingredients are coming. And these ingredients, they are coming from different countries. So it's a global cheeseburger. We do not know origin of raw material, we do not know origin of any of the material which is going into that. So different kinds of system, a very complex system is playing role. Many systems, many interactions. So therefore, a new systems approach is being proposed for food security and food safety. And One Health approach, you must have all heard about One Health very commonly in recent times. So this is one of the systems approach where we take care of human, animal, as well as the environment. So This One Health approach is very good approach, particularly for foods of animal origin, milk, dairy, aquaculture, and all those things. So, since there are various dimensions, different systems playing role, so in each of these systems, there are different disciplines which are playing important role. And unless we have collaboration of all kinds of different disciplines in animal health, human health, environmental health, and this collaboration should be at international, regional, national, as well as local level. We just will not be able to tackle these food safety issues, and we need a concerted efforts from all stakeholders into this. In future, what is going to happen, since it is a complex system, it is beyond the manual management. So newer technologies, digital technologies, they are going to play a big role. So there would be sensors, GPS based tracking systems, big data analysis, all kinds of machine learning, artificial intelligence, computer simulations, blockchain for traceability. So these are going to come very soon into this. So anybody who is interested, they can also choose these fields for learning for food safety management, because multidisciplinary approach would be required to come out with solutions for food safety management. Here I have given one example. This is a food watch system, which has been very recently developed by Dubai Municipal Corporation. For It's a local system for food safety management. Here, it's an app-based system, mobile app-based system with all kinds of backup servers and backup softwares at the Dubai Food Safety Authority offices. Here they have nutrition information, food handling information, vehicle information, training, pest management, temperature monitoring, surveillance of food safety issues. Every information has been integrated in one food watch app. It becomes very easy now for them to monitor the food safety. So coming to national and international organizations which play a very important role. First is a national organization, Food Safety and Standard Authority of India, which is the most important organization related to food safety. Here are some of the timelines for the food safety regulations which happened in India. 2006 was the watershed year in terms of food safety management. FSS Act came, so Food Safety Standard Authority was established. And then all these rules which were governed by different ministries, different governing bodies, they came under one Food Safety and Standard Regulations 2011. So these different acts, different orders now are under one umbrella of Food Safety Standards Regulation 2011. Now we have one nation, one food law. So FSSR 2011 is now mandatory. We were having some standards like Bureau of Indian Standards as well as AgMark standards, but these standards are voluntary. It is not compulsory that you should have BIS or ISI mark or AG mark unless it is recommended or it is endorsed or it is ratified by FSSR. So there are some foods where, although Bureau of Indian Standards have been ratified by the FSSR, and therefore they are mandatory. Similarly, there are some foods, oils and ghees where AgMark standards have been endorsed by the FSSR, and therefore they are mandatory. Otherwise, these are voluntary standards. What is the composition of this food safety authority, how the administrative work happens? This is administrative work. There is a food safety standard authority with the chairman and members. then Chief Executive Officer, that is Commissioner, Central Commissioner of Food Safety, and then there are state level authorities, state level commissioners, officers, different designations of the officers. They are looking after the regulatory aspects of the food safety. Whereas scientific panels, they are the basic members or basic, I would say, standard setting panels. So standards are recommended by these scientific panels. These standards are then ratified by a committee, and then finally food authority approves them. What is the role of FSSAI? As I have said, all the national standards laying as well as guidelines which came into the enforcement, they are being prescribed by the FSSAI. Limits for residues, microbiological limits, toxins, all the labeling standards, different methods which are to be recommended for analyzing these residues, microbes, then laboratory accreditation guidelines, as well as import control is another important part of the FSSAI. All food which is coming into India from different countries is regulated by the FSSAI. In addition to that, there are several other scientific technical functions, which as well as networking functions, communication functions that Food Safety Authority play. As I was talking about scientific panels, these are different subject-based scientific panels which set standards. Like pesticide residue panel will set standards for pesticide, likewise antibiotic. Biological hazards is responsible for microbiological standards. So these are subject-based standards, subject-based panels, sorry. There are panels which are commodity-based. So here is a fish and fish product, means they will look only into fish and fish product. Likewise for meat, milk, cereals, fruits. So these commodity based panel will only set standards related to that commodity, specific commodity. Here are some different sections of FSSR 2011. So these regulations, rules are in different section. This food product standards and food additives, this section contains standards related to microbiology. So microbiological limits have been set, are given in this FSSR 2011, as well as food additives. These are given here in this section. Whereas all kinds of residues, heavy metal contaminants, as well as toxin, aflatoxins, and all others, they have been given in this section, that is contaminants, toxins, and residues. There are packaging, labeling, regulations, laboratory sampling analysis regulations, licensing regulations. So different regulation sections are there in FSSR. Additionally, some new regulations in 2016, 17, 18, they have come for organic food, alcoholic beverages. Now we are getting all kinds of nutraceuticals. So there is a regulation related to nutraceuticals or dietary supplements. Fortification of foods is one of the big businesses nowadays. Additions of some vitamins, some minerals into foods. So these regulations have recently come up. Second is Bureau of Indian Standards. As I have said that standards are voluntary, no legal standing unless they are adopted by the FSSAI. So this was initially known as ISI, and they are also into standard formulation. They are into big way in certification and calibration services, and they are harmonizing all ISO standard, that is international standards. They are harmonizing with Bureau of Indian Standards. In FSSAI, we have methods of analysis of microbes, methods of analysis of pesticides. So several of IS method, that is Bureau of Indian Standard methods, they have been endorsed by the FSSAI as official methods. So whenever testing of food is to be done, it has to be mandatorily done by either IS method or ISO method. So wherever there is a food safety standard authority gazette notification or endorsement comes, they become regulations or enforced by the law. Another body in India is Export Inspection Council. This is basically not dealing with domestic products, but they are dealing with export trade. So all quality assurance inspection prior to export is being done by them. So they are ensuring that whatever commodity is being exported from India, that meets the standards and meets the quality of the importing country. Then APIDA, you must have heard that Agricultural Processed Food Product Export Development Authority. This is a supporting body. It is a promotion body. It helps manufacturers of food items to come up to the level so that they can export the products, so that their quality is good. So they are just promotional bodies, supporting bodies for all those manufacturers who want to export the commodities. They handhold them. Then our Ministry of Fisheries, Animal Husbandry, Department of Animal Husbandry and Dairying, how they play role in the food safety by ensuring the import regulations of live animals. So any exotic disease which may have food safety implication, that entry can be restricted by these regulations. If some country has some disease, X disease in their poultry, which is not found in India, then through regulations we can stop their entry. And these regulations, they are being set by, or they are being recommended by this Department of Animal Husbandry. Similarly, for drug use, they issue guidelines so that antimicrobial resistance as well as drug residues issues can be tackled. For Ministry of Health and Family Welfare, this FSSAI is a part of Ministry of Health and Family Welfare. In addition to FSSAI, National Center for Disease Control, NCDC, they have one integrated disease surveillance program where foodborne diseases, diarrheal diseases, they are being monitored, and then data is coming, how many cases, how many deaths are happening because of this. In addition, they are also issuing antibiotic usage guidelines. Then I was telling you about Agmark. This comes under Ministry of Agriculture, that is Directorate of Marketing and Inspection. They also have some kinds of quality standards, grading and certification. But now basically they are more into quality grading and certification. They are issuing Agmark, which is indicative of quality grading. They also have INDGAP certification. I was telling you about the good agricultural practices. So DMI is the authority which gives certification for good agricultural practices as well as organic husbandry or organic agricultural practices. In addition, just like our Department of Animal Husbandry Dairying, they have Directorate of Plant Protections, which regulates import of plant germplasm, as well as they are responsible for regulations and approval of pesticides used in agriculture. So indirectly, they are also in the part of food safety management domain. Then Quality Council of India is another body. This is basically accreditation body. It promotes quality system throughout India. You must have heard NABL laboratories, those which are accredited by this National Accreditation Board of Testing and Calibration Laboratories, which comes under QCI. So FSSR states that testing will only happen in NABL accredited laboratories. Those laboratories which are doing testing but they are not NABL accredited, those testing will not stand in the court of law. We have seen it in the Maggie issue. The testing was done in some state laboratory which was not accredited, so the court turned it down. So this again, QCI is playing important role. Then this is also accreditation body for certification bodies. That is, HACCP certification is given by some certification bodies, as well as quality management system certifications, they are given by certification bodies. So accreditation of these is done by QCI. So a very important apex organization which governs quality of all kinds of activities. Coming to international organizations, first we will see UN, or Intergovernmental International Organization. Uh, Codex Alimentarius Commission is what internationally, which is FSSAI is for India. So it's a intergovernmental body which was joint venture of FAO and WHO. It coordinates food standards at international level. So whatever regulations, standards which are, not regulations, whatever standards which are set by Codex, pesticide limits, MRLs, microbiological standards, they are internationally acceptable. So they are doing it with all kinds of scientific risk assessment, and therefore these standards, they have been also endorsed by World Trade Organization as a important standard which are internationally acceptable. This why this is necessary, because when international standards are accepted, it ensures that there is a fair trade practices are ensured, and nobody can unnecessarily stop the trades. Similar to what FSSAI has, like subject committees, Codex also has similar committees dealing with pesticides, microbes, contaminants, veterinary drug residues, and so on and so forth. And similarly for commodity-based fish, milk, meat, cereals, and other commodities. Then World Health Organization have already told that Codex came as a joint venture of WHO. So one of the important components of Codex is World Health Organization. In addition to that, it also helps in advisory role in food safety, although it has a specific mandate of protection of public health, but through food safety it is going to protect public health. So it is basically advisory role. It also has a surveillance programs. The first two slides of foodborne epidemiology reference groups report about foodborne disease burden, I have shown you. This was done by World Health Organizations. Then they are also playing role in risk assessment. There are different committees which are joint committees of FAO and WHO. That is a joint expert committee on food additives, JECFA, then pesticide residues, then microbiological assessment. So these are doing risk assessment. Then networking and communication, we have seen how World Health Organization plays a pivotal role internationally whenever there are risks or international problems which are arising. So International Food Safety Authority networking has been done by WHO and FAO. FAO is another important intergovernment organization. Again, this also is a part of Codex. So basically, Codex is a joint venture of FAO, WHO. Although its core mandate is food security, but through joint efforts of WHO and FAO, through various expert committees and through Codex, they are playing important role in the food safety management. OIE, that is World Organization of Animal Health. Again, it's related to our profession. It came into existence basically to fight animal health problems or animal disease problems. It is responsible basically for the improving animal health, but this also plays role through, as we have seen, Department of Animal Husbandry and Dairying that is doing. That is all trade related diseases, transboundary diseases, zoonotic diseases which are playing role through animal foods. These are all governed at international level by World Organization of Animal Health, that is OIE. And again, this is recognized as a reference organization for animal trade by WTO. What is WTO? That is World Trade Organization. This was initially came as a general agreement for trade and tariffs. Later on, it became an intergovernment organization, and with a large number of member countries, its function is to regulate trade. So when it is regulating trade, all food safety issues also they have to be tackled. Disputes have to be solved, and these disputes they are solved based on the Codex guidelines, based on the OIE, WHO's recommendations. So these are taken as a benchmark standards. But under Codex, under these WTO trade agreements, we have a SPS agreement, that is sanitary and phytosanitary measures. What is this sanitary and phytosanitary measures? That means countries can have their own regulations related to food safety, animal health, and plant health regulations. And there are certain basic rules which are to be taken into consideration while setting these standards. So what India is doing, like setting up food standards, we have to follow these basic rules. So it allows countries to set own standards, but these standards should be based on science and not just arbitrarily say, I want that, okay, 100 ppm of this particular toxicant should not be in X product. That is not the case. Why 100 ppm? Why not 200? Why not 10? So this has to be based on science. It has to be based on all kind of a risk assessment and scientific justifications. As a country, we may set these basic rule encourage us to use international standards set by Codex, but we can use higher standards or better standards than Codex. But we have to give scientific justification, and it should be based on risk assessment. So basically, if some country has some kind of a, as I was telling you, that poultry disease is there in some country, X country, and we do not have that poultry disease. So under this SPS agreement, we can stop raw meat coming from that country to India. We can say that, okay, there are chances that this disease may come to our country through raw poultry meat or chicken. We will not allow this to happen, and under SPS agreement we can stop import of those commodities or those animals, birds, etc. There are non-government organization, ISO, just like the Bureau of Indian Standards. They develop international standards which are voluntary, and BI is one of the members of this ISO. These are standards which are set by them. That is HACCP standard. Basically, all over world, this ISO 20000 is used as a benchmark standards. Then methods of analysis, they have also been ratified by FSSAI. So several standards which have been recommended by FSSAI, they now become compulsory. International Commission on Microbiological Specification for Foods, I have already talked about it. This is a non-government organization. It is also member of Codex committees on food hygiene and CCMAS, so they are also contributing into it. And it is a leading independent, impartial body which is playing role in microbiological food safety, with a very few members, about 20 members, and they are not a national delegate but technical experts. ICMSF is doing work through books, concept papers, different kinds of papers in journals. So as I was telling you, this sampling plan, microbiological criteria, this concept came first in 1970s in the book second. Then HACCP concept was introduced by ICMSF in 80s. Then risk management concept was introduced in early 2000s as FSOs and all POs. So basically in microbiological food safety management, this is one of the important organization whose recommendations, whose concepts are taken globally. Then AOAC, this is again methods of analysis. They are important component of AOAC. Again, it's a voluntary kind of a thing, but when it is ratified by FSSAI, there are several AOAC methods which have been recommended for pesticide residue analysis or antibiotic residue analysis or certain other methods also. When they are recommended by FSSAI, they become the standard methods of analysis for Indian context as well. You'll see again, it's an organization which is private, different food manufacturers, they have formed these organizations and basically playing role as a recommendations or guidelines or papers into nutrition, food safety, risk assessment. Then here are some different bodies which are certification bodies. Uh, there are several certification bodies, but Global Gap is one of the recognized for the certification of good agricultural practices into livestock, also animal welfare, livestock transportation, all certifications they are giving. Similarly, there are SQFs, BRCs, they also issue certification. So several certification bodies, they have now formed a global food safety initiative. Now they have come under one umbrella and they are issuing certifications related to food safety. And many of them, they have also offices, bodies in India. So finally, to conclude, it's a very, very important issue, food safety. And then because of all the complex global food chains, new hazards keep on coming. They are going globally from one country to another. So we need a very dynamic food safety management with all kinds of new digital inputs. And systems approach, One Health approach is one of the best for our animal based foods, and we need kind of all stakeholders collaboration at all the levels. So thank you very much. Thank you.
Thank you, sir. It was a very informative talk, a very enriching presentation where you, I think, shared each and every aspect of the food safety management system, right from the end product testing to the hazard-based system and the risk-based approaches and the new concepts that is a system approach. And then finally, the food regulatory authorities in India as well as abroad. So thank you, sir. You indeed present so nicely. This whole, I think you are really the authority of food safety as far as the veterinary aspect is concerned. So, sir, we have a few couple of questions for you. One is that how FSSAI regulates the small stakeholders, as many vendors are selling their products on the roadside.
FSSAI has a registration system. Under that registration system, they have to follow the hygienic practices. There are different schedules which are given. Uh, and those schedules, they have to be followed by these small vendors, particularly except meat. All others, through those schedules, they have to maintain all good hygienic practices. There are Schedule 1, Schedule 2, Schedule 3, Schedule 4. Schedule 4 is dealing with meat and meat products. Now, the rules, regulations related to small vendors of food, this meat and meat product has very recently changed. But for all other foods, these schedules, they have to be complied by these small vendors, and they have to compulsorily register with Food Safety and Standards Authority. Related to meat, recently this amendment has come. Now all small vendors also, they have to comply not only with this schedule 4, but they also have to comply with FSMS, that is Food Safety Management System, that is HACCP system. So for them, it has become complicated, and slowly they want to sort of limit these small vendors, and they want to make it in a organized way so that risk to human being through meat and poultry food is minimized.
Okay, thank you, sir. So, sir, how do they like implement checks on these vendors? Like, do they routinely test the samples, or how this monitoring is done by FSSAI?
They have to routinely visit. The food safety inspectors are there in every district. They go and check routinely whether these food safety schedule 4 is complied or not. But at ground level, it becomes very difficult. There are only one or two food safety officers available with large number of small vendors like spread across the cities. So implementation part, still there are certain issues related to manpower, infrastructure availability, laboratories for testing, and so many issues are there. But theoretically, it is all laid down.
Okay. Sir, the next question is from Dr. Dubal. He says most of the Indian standards set by FSSAI are based on the European Union and Codex standards. So, how our products can comply with those specifications?
These are not only based on European standards or Codex standards. Of course, Codex standards world over, they say that we have to have harmonization with Codex standards. But these standards, even Europe or Codex, they have based it on the science, that is scientific risk assessment. So they are not coming out of the blue. They are based on risk assessment. So if we have some standards which are similar to Codex, there is no problem. But in India, we also have done all kinds of risk assessment in panels. As I have told you, biological hazard panel. I was member for a few years. Before that, there were some other people. Now also there are some other people. But we do scientific risk assessment, take all the data related to, because our temperatures are different. We are a tropical countries. And if we set standards which are say not as good as European, and if we allow them to have a more number of organisms, then definitely within few years it is going to create problems. So we have to have even stricter standards than Europe or Codex if we go by logic. But we do all scientific risk assessment, and only after that we harmonize standards with Codex standards.
But I think, sir, that holds true for microorganisms. But as far as residue problem is concerned, I think we can't have more stricter standards than them because we don't
No,
have
no,
such,
yeah. For residues, it is at par with Codex, almost at par with Codex. In case of pesticide residues, there is one practice. When Department of Agriculture and Cooperation gives approval for any pesticide for use in agriculture, they have to submit a dossier to DAC. And in that dossier, they conduct all kinds of experiment in three different locations, that is agroclimatic zones, in different crops, in different season. And then they come out with all residues and all residue data. And then there is one OECD calculator, and with all inputs related to say what we can say, the toxicity studies in in animals, chronic toxicity, acute toxicity. Based on those toxicity study, OECD studies, acceptable daily intake through OECD calculators, these MRLs are fixed. So this is also done by pesticide residue panel as well as these residue panels, very scientific way. So there are certain standards which are not exactly as Codex standards in India. Certain pesticides we have higher standards as well.
okay, sir. So there are many questions actually pouring in. But one more question is, how is FSSAI tackling with the problem? Wait, sir. How is FSSAI tackling with the problem of adulteration in honey, as the current standards are unable to detect the adulteration of sugary water?
There is a problem related to method of analysis, particularly the rice syrup, because uh, sugars or rice syrup sugars, they are added in such a small quantity. Particularly the what I can say, the marker components, they are in a very minute quantity, and methods of analysis LCMS MS is being recommended, but they are finding it out how to tackle with this issue. So basically here problem was with the method of analysis. There are not very standard and very good methods of analysis for detection. Detection of disaccharides, of course, sucrose and all, that is not a problem, but marker compounds of some of the rice starch or rice syrup, there are certain problems, issues involved in that.
Okay, thank you, sir. One more question is there. Are there any set microbiological standards for food for consumption by the zoo animals or the wildlife?
No, for consumption of animal, FSSAI is not doing any regulations. Even for animal feed, there are no regulations.
So FSSAI is not looking, they are looking after the animal products, but not for the products for animal consumption.
Not for the products for animal consumptions.
So, sir, we have another webinar on brucellosis right now. So I think we would end this talk here, though there are still questions. So we would be, I think, be in touch with you. If there are any doubts, we would keep on clarifying from you, sir. So thank you again for accepting our invitation. I sincerely thank on the behalf of the IDP cell and on the behalf of my Director, School of Public Health and the entire team here. So thank you so much, sir, for being with us today.
Thank you very much.
Thank you, sir.
Thank you.
Hello, Dr. Saab, namaskar.
नमस्कार नमस्कार भास्कर सर नमस्कार सर आवाज येत नाहीये
या थँक यू किरण सर
थँक यू व्हेरी मच. धन्यवाद.
डॉक्टर